I'm sorry, but when I get my blood drawn at the doctor, I don't want none of you young lit bitches taking my blood. If you got giblets on your Crocs, get the fuck away from me. I want Miss Earlene with that shake and go wig and that badass attitude to get me right. She been doing this longer than I.
Hi everyone, welcome back to my channel. Today we're diving into a hot topic in the nursing world. Has nursing become an aesthetic? Are people entering this profession just for the looks of it? Or more importantly, why does physical appearance or age not equate to competence or incompetence in nursing? Let's talk about it. Let's be honest. There's been a growing trend on social media where nurses, or especially younger nurses, are showcased looking trendy, fashionable, really put together. While there's nothing wrong with presenting yourself well, some have raised concerns, questioning whether this has led to a superficial image of the profession. Have people started nursing just for the aesthetic or just for the looks of it? People have their nice Stanley cups, their bug bags, their Crocs. It is important to recognize that nursing first and foremost is about patient care. The clothes you wear or how polished you look does not define your ability to take care of patients. Being a nurse is about skill, knowledge, compassion. It's not about how good you look in scrubs. So the first thing that I would like to talk about is physical attraction, physical appearance. Does it equate to incompetence in nursing? There's these unfortunate stereotypes that younger nurses who dress nicely or have a specific look are less competent or they're not taking their job seriously. But here's the truth. Physical appearance does not define competence. If you think that physical appearance defines competence, that's questionable. In fact, most of the most skilled and knowledgeable and competent nurses that I've worked with are younger nurses. Those who care about their appearance, they are pretty good at their job too. They may look great while they're on shift, but they also bring a high level of care, critical thinking, deep medical knowledge to their patients. And it's very unfair to judge someone's capability based on how they present themselves. If you made it this far and you like this topic, please consider subscribing to this channel. You see, nursing isn't just something that you can wing, because you look good. Every nurse, no matter their age or their appearance, they've had to go through rigorous schooling, to pass these exams, to endure these very demanding clinical hours that, make up the education of nursing. Your skill set isn't about, your clothes or how good you look in them. It's in your brain, it's in your heart, it's in your hands. Another topic that I would like to discuss along this line is, does experience always equal competence? I've worked with a good number of nurses, so let's flip the conversation a little bit and let's stare this way. We often assume that just because someone has been a nurse for donkey years, well, then they must be better or they must be more competent. But let me ask you this. Does experience automatically equate to competence? I don't think so. If you think so, leave a comment below. I don't think so. That, necessarily not. I've worked with nurses who've been in the field for 20 plus years, but they're very resistant to change. They're less adaptable. Sometimes they're even less efficient in handling modern things and, new protocols. On the flip side, some newer nurses come in ready to learn. They stay updated with the latest research. They're more open to using modern tools in healthcare. They're more open to learn. They're more moldable to fit what you need them to do. And I may be wrong. Experience does bring valuable knowledge. I have to give it that, and insight, but only if that nurse stays engaged and learns new techniques and evolves with the profession, because nursing is constantly changing, and the best nurses are the ones who grow with the profession regardless of how many years you've been in the field, whether young or old. So, how do we balance knowledge and adaptability? Your knowledge and years of you being a nurse, Because the best nurses, whether new or experienced, are the ones who blend knowledge with their adaptability, the ones who are willing to work hard and keep learning and embrace the new challenges of the nursing profession. But good nursing doesn't care how long you've been doing the job and how great you look in scrubs. It's about the passion that you bring, the ability to learn, the capacity to which you care for others. Nursing is a calling. It's not an aesthetic, and we should be celebrating that because, yeah, we need to celebrate the calling of nursing. So here's a takeaway. Whether you're a young nurse, fresh out of school, or you're someone that's been in the field for years, it's your skills, your dedication to, the patient care, your willingness to adapt to changes is what matters most. Your evidence-based practice. Nursing isn't just about how we look. It's not about how long we've been at it. It's about how well we care for those who need us. If this is something that interests you or something that you would like to discuss more, please make sure to leave a comment below. Let's discuss. And as always, thanks for tuning in, and let me know your thoughts in the comments. Do you think nursing has become more of an aesthetic lately? Or what do you think makes a truly great nurse? Don't forget to subscribe, and I'll see you in my next video.